Thanks everyone for joining us today. We're going to discuss the recent ONC updates and what that means for certified developers. Now, this is just an overview. There are many details to these changes in the proposed rule. We're highlighting just some of the main points. Most of you attending today know Drummond from testing and certifying to the ONC program. For those that don't know us well, Drummond offers comprehensive compliance across several different vertical industries, healthcare just being one of them. We specialize in compliance and security, and part of our program is working with organizations like yours to help you get through this process. We have teams of experts that understand the regulations, and they're here to help you understand them as well. On this slide, you'll see a list of the comprehensive services that we currently offer, and you'll also see here our partners with Lares. They specialize in cybersecurity and information security, which we'll discuss in a little bit more detail in just a moment. So today we're going to start by clarifying the three major ONC updates that were just released. We'll discuss the impact of the changes to the CMS measures, the ONC e-prescribing criteria, and the proposed rule for the 21st Century Cures Act. At the end of our presentation, we're going to briefly discuss a new series with our partners, Laras. They're being highlighted in this webinar because of a new blog series they created specifically for health IT developers. The first of the series being Prevention of Digital Theft of EHR Data. I'm Melissa Martin, and I'm your host today. I have two panelists to discuss these topics. First, I have Sonia Galvan, our Certification Program Director for our Health IT certification body. She's tested a lot of the products that are currently Drummond certified, and she's extremely knowledgeable in both testing and certification. Our second panelist is Chris Nickerson. He's the founder and CEO of Laras. He's agreed to join us briefly to discuss security of healthcare data and then again that upcoming blog series. We are recording the presentation today. We'll send a link out later this week. We're also accepting questions during the webinar, and if we don't get them answered during the presentation, we will answer them via email, so please keep those questions coming. Sonia, let's go ahead and get started with the CMS Measure update. What does this mean? What was impacted? And then will you give us some background on the new test procedures?
Yes, thank you, Melissa, and good afternoon, everyone. So the ONC did recently release the very much anticipated test procedures for criteria 315G1, the automated numerator recording, and also G2, the automated measure calculation. So currently testing is available for both eligible hospitals and eligible clinicians. So there are three new CMS measures that were added to the test procedures, and those include the support referral loop by receiving and incorporating, the query PDMP, and the verified opioid treatment agreement. So first of all, the support referral loop for receiving and incorporating. So this measure is required for 2019 Medicare reporting. So CMS combined the former clinical reconciliation and request accept summary care measures into this one new measure. So if your product is certified to 315B1, transition of care, and 315B2, clinical reconciliation, then you'll need to come back and retest for this new measure. So developers will be required to submit screenshots of calculations using the ONC test data. Live testing will not be required for developers whose products were previously certified. And so here at Drummond, we recently released updated proctor sheets, and they include a template to submit the screenshots. So again, recertifying to this measure is very important, as this is still a required measure for 2019 CMS reporting under the Medicare program. Now, ONC also added testing for two optional measures for e-prescribing, which are the query PDMP and the verified opioid treatment agreement. So for query PDMP, as many of you may be aware, CMS recently updated so that the eligible hospitals, the calculation requirement was removed, and they changed it to an attestation. So to align with that, the ONC also removed the testing requirement for eligible hospitals for this particular measure. Now, this measure is still considered optional for eligible clinicians. Therefore, if your product is certified to B3, the e-prescribing criteria, then you may want to certify this measure based on the needs of your clients. Now, testing for this measure is conducted by a self-declaration under criteria G1 and G2. And the recently released proctor sheets from Drummond include a template in order to submit the self-declaration. The Verify Opioid Treatment Agreement, this is the second optional e-prescribing measure for 2019. It does apply to both hospitals and clinicians. So just note that CMS did finalize to remove this measure for hospitals beginning in 2020. So for any developer wishing to test this measure, it is also conducted by a self-declaration under criteria G1 and G2. So certainly a lot of changes to keep up with. Now to summarize, if you wish to test any or all of these CMS measures, you'll need to register to test either G1 or G2. And it depends on what you were previously certified for. Testing and certification fees do apply. You can either submit a registration form online at drummondgroup.com, or if you have not already submitted your third quarterly attestation, you can request testing by indicating you made changes to your software. And just as a reminder, the third quarter 2019 quarterly attestation, those are due tomorrow, October 18th, so please be sure to submit those if you have not already. And then finally, we strongly encourage developers who have any testing remaining to please register soon. Our last day of testing here at Drummond for 2019 will be December 20th.
Sonia, thank you for the CMS clarification. Now, the ONC also recently updated another update to the Health IT certification program, but this one's pertaining to e-prescribing criteria. Can you explain what this means for developers?
Yes, so that is another very important update, and it affects several of our developers. So last month, the ONC issued an update to e-prescribing criteria 315B3. So it's a flexibility, and it allows developers to update their certified software to the new NCPDP standard. So this updated standard aligns with the CMS Medicare Part D requirement, which is to conduct electronic prescribing solely using the NCPDP script 2017-071. So developers are not required to recertify when updating to the new standard, but will be expected to notify their ONC certification body once the update has been made. So for Drummond certified developers, you can notify us through your quarterly attestation. You'll have an option just to mark yes or no whether you have implemented the standard yet. But if you have not yet implemented the standard, we're working on another method to notify us before the end of the year. Or you can just notify us through your next quarterly attestation, which will be sent out the first week of January. I also want to add a few clarifications, confirmations that developers should consider in regard to this criteria 315B3. So again, this is a CMS requirement. Your certified software must conduct e-prescribing using the updated NCPDP standard effective January 1st. Now, also as of this date, ONC certification bodies will not be permitted to certify products to B3 using standard 10.6. Okay, so any developer who still needs to certify for e-prescribing for 2019, you can still test it until the end of the year using 10.6. However, you'll then have to make the update to the new NCPDP standard after certification. Now, for any developer who has not updated their certified software to the new standard by January 1st, your ONC certification will not be impacted, okay? However, your client CMS attestation will likely be impacted in some way. You'll need to notify your clients if your product is not going to meet the CMS compliance requirement, and then certainly address any concerns or questions about this directly with CMS if need be. So this is a very important update, and we just want to make sure our developers are ready for January 1st.
Now, I know that the electronic prescribing of controlled substances, or EPCS, doesn't pertain to the ONC program, but this may actually apply to some of our audience. Can you tell us what happens if they have an EPCS certification?
Yes, sure. So the EPCS certification that we're referring to here is outside of the ONC 2015 certification program. So it's a separate certification. It is available for any products that support electronic prescribing of controlled substances. So for developers who maintain an EPCS certification, you want to take note that the DEA federal regulation does require, it mandates a recertification when updating to the new NCPDP standard. This is because you're making a change to your EPCS functionality. So if you have your own EPCS certification, you'll need to recertify. Or if you're using a third party for EPCS and you would like to get an integration review, we can do that. So if you have any questions, please do email us at epcs@drummondgroup.com, and we'll be able to help you through your compliance needs.
Thanks, Sonia. We appreciate those clarifications for the e-prescribing and even for the controlled substances prescriptions. Many of you on this call are aware that this is a proposed regulation that may bring more changes to the ONC program under the 21st Century Cures Act. So can you provide a little insight as to what these developers can expect as part of this regulation?
Yeah, so the 21st Century Cures Act, so it's not yet been finalized. We don't have a specific date as to when it will be finalized, but we anticipate by end of year, but this is just based on our own speculation. So pretty soon. Now the proposed rule, it does contain a lot of changes to the current 2015 edition program. And this will impact majority of our developers, as some criteria are proposed to be removed, some revised and updated, and of course there's new criteria. So we just want to consider some of the proposed changes today. The points chosen for discussion are by no means comprehensive. So we encourage everyone to read the proposed rule in its entirety and to stay up to date once a new regulation is issued. So some points we chose to consider focus on proposed changes to the current 2015 edition criteria, the conditions of certification, focus on interoperability, and then the removal of the 2014 edition. So to begin with, we'd like to share a document that was created by the ONC. And here in this first half, it identifies criteria that's proposed to be removed from the base EHR criteria list. As you can see, it includes problem list, medication list, allergy list, and smoking status. So keep in mind, these elements are still required to be supported in structured format, but just not tested as part of these specific criteria. Also take note, there are additional criteria listed here proposed to be removed, again, from the ONC 2015 edition program. The next slide identifies criteria proposed to be updated. So developers certified to any of the criteria on the left column are expected to come back and test and certify to the associated updated criteria under the right column. So this includes new e-prescribing criteria, B11, new data export criteria proposed under B10, EHI export. There's new data segmentation for privacy, for sending and receiving, and also API for population, patient and population services under G10. Next, we have criteria proposed to be revised. So retesting and recertification, it may not be required for this revised list, but we won't know for sure until the final rule is released. So as you can see from this list, this too will impact several of our certified products. We have proposed revisions to CQM criteria C3, changes to the Common Clinical Data Set, also changes to the CCDA Companion Guide, as well as updated standards for A12 family history, F1 immunization registries, and F2 syndromic surveillance. And finally, we have a list of the new criteria. So first we have G11, which is the consent management for APIs. So this was proposed as an optional criterion under 2015 edition. And it's based on a system responding to requests through an API for patient consent directives. Now the next two criteria, if they're finalized, these will impact nearly every certified product. And developers will be required to add this new functionality and to attest on their own if their product meets compliance. And that's for D12 encrypt authentication credentials and D13 multi-factor authentication.
21st Century Cures also has a strong focus on interoperability. Would you also explain how this regulation might have an impact on that?
Mm-hmm. Sure. So as part of the 21st Century Cures Act, Congress commissioned the ONC to develop a trusted exchange framework, including a common agreement for the health information networks. And this is referred to as a TEFCA. So this is vital as we move towards establishing an interoperable health system. Now, there has been significant work already among health information exchanges at the regional and national levels. Now, to move forward in this effort, the ONC recently awarded the Sequoia Project, a cooperative agreement to serve as a recognized coordinated entity, RCE. They will develop and implement, maintain the common agreement component of the TEFCA. Now, in the proposed rule, ONC also requested comments as to whether developers should be required to participate in the TEFCA as a way to provide assurance to customers and to the ONC to ensure that they're not conducting any info blocking activity. This is not finalized, but certainly something to consider and review should it become a requirement. We have a URL here on the page. Please visit that for more details. Now, the TEFCA references the U.S. Core Data for Interoperability, the U.S. CDI. And this is going to be the required format to exchange data if finalized. So the US CDI, it specifies a common set of data classes in order to support that nationwide interoperability. It's proposed to replace the Common Clinical Data Set under the 2015 edition. So the US CDI builds upon the data elements within the current 2015 CCDS. And it adds 2 new data classes, which are clinical notes and provenance. A new data element has also been added under vital signs, focusing on pediatrics. And this relates to the 21st Century Cures provision to support pediatric health IT. Now, if finalized, developers will need to update their certified software in order to support any criteria affected by this change. The proposed rule also explains that developers must provide their customer software no later than 24 months after the effective date of the final rule. While recertification may not be expected, when making the change for the US CDI, a notification to your ONC certification body may be needed. Now, going on further, the CARES Act proposes also conditions of certification. Now, this entails developers attesting and demonstrating to initial and ongoing certification compliance requirements. So these conditions focus on 7 categories, but we've just selected a couple to highlight here today. First of all, the real-world testing for interoperability. Now, this would apply to products certified to specific criteria related to data exchange. Developers will have to attest and provide verification of real-world testing by submitting annual test plans and test results which focus on interoperability. This information will be made public on the ONC Chapel website. Also, Drummond is developing a method to help developers comply with this requirement. We will have more details for you once the rule is finalized. Developers will also have to attest to not taking any action that it constitutes any information blocking activity. In the proposed rule, ONC defined what that means and also provided some additional guidance by identifying reasonable actions that would not constitute information blocking. So this is a very important aspect of the regulation. And any findings of information blocking could result in civil penalties or disincentives. There are additional requirements that developers will have to attest to and to comply with under the conditions of certification. Again, we just highlighted a couple here for you. Another item for consideration is the proposal to remove the 2014 edition from the ONC program. This one really comes as no surprise, especially given that providers and hospitals can no longer use these products for CMS reporting. As of today, many developers still have active 2014 edition certification listings on the ONC Chapel. So if this applies to you, you may elect to withdraw these certification listings now if you no longer have customers using it or no longer support these products. Now, for Drummond certified developers, you can request a withdrawal through your quarterly attestation, or you can register on our website and elect service option withdrawal. So again, this information about 21st Century Cures Act, by no means exhaustive. There's so much more to the proposed rule. We simply selected just a few areas to highlight and just to give you some insight on what to expect. Once the rule is finalized, Drummond will be providing additional webinar sessions to answer questions and guide you through any new testing and certification requirements.
Thanks, Sonia, for sharing all that information on the major ONC updates. So on this slide, you'll see several different resources that were discussed here today. The first being a link to the proposed rule, and then another to the ONC NPRM page. You'll also see a registration link for our website, and then another important link that we want to highlight is the Drummond Customer Portal, and this is for those that are certified to the 2015 edition. If you haven't accessed it yet, this is where you'll find FAQs, important updates, proctor sheets, quarterly attestations. You can open up tickets to ask your proctor questions, has a lot of really useful information, and is open to anyone with a certified product to the 2015 edition with Drummond. If you don't have access to the portal, just shoot us an email at certification@drummondgroup.com. Now I want to move on to our security spotlight with Loras. Again, Loras is our partner in information security, and they're here today to discuss this as it pertains to health IT developers. Chris, I'll just go ahead and let you begin.
Awesome. Thank you so much for inviting me today. I really appreciate it. So we were kind of invited in through our partnership to start looking past compliance and being able to look at what the tenets of security are beyond compliance, because the approaches that we've taken thus far as an industry have tended to fail us. We see increasing amounts of vendors, increasing amounts of software providers, care providers, et cetera, all becoming part of the risk focus of external attacks. Back in like 2017, there was a task force that was created to kind of take a look at healthcare and cybersecurity. And the output of that was that in clinical terms, that healthcare in general was in critical condition, that there was issues with data theft, with the ability to curate and hold data, the ability to have all of these items that are now starting to be connected for the hyper-connected patient experience, which can be everything from records, data, healthcare, all the way out to an insulin pump or something that's active there while care is being provided. And as you know, being vendors in the space that are creating some of that code, there's often tie-ins that are going to these systems, both for administration, for allergy, for reaction, as well as to make split-second care decisions. So what we've been trying to do with our partnership with Drummond is use their kind of expertise and leadership in the comprehensive compliance space and Loras' leadership in the information security space as a motivated, defined adversary who releases lots of research around how these types of things actually work in the wild and ways to protect the people that are kind of getting into this scenario, both the providers, the developers, the consumers, and the patients themselves. So a little bit kind of about us. If you go to the next one. Sorry, I can't drive. So we're going to kind of take on this blog series to sort of digest some of the information in which we're presenting out to try and help as much as we can to get people in the mindset of where are these kind of gotcha points, where are things that are happening in the space right now. The first article in the series is kind of on digital theft and dark web profiteering, really talking about where does where do the records come from? Where do people start to look for these records? How are those records then used, not only to make a profit, but also be able to directly influence both the patients' lives and the overall success of the organizations that are holding that data. Unfortunately, security has now become something that if you are adequate in your security program or you're showing that your diligence in the security program goes beyond compliance, it actually is providing a competitive advantage. Most customers, when they're out there and they're looking for an EHR and EMR vendor at the larger levels, are now taking into consideration what the security of those are. because if these types of things get compromised, it's not always the vendor, but sometimes the actual care provider, hospital system, or portfolio in which is providing that care. So they say that, you know, this particular health system has lost X millions of records, versus just the vendors themselves. So now the consumer is looking at security very deeply as a competitive advantage, so that the more secure you build your product, the more likely it is to be a competitive advantage in the sale of those products. We're also going to talk about some other things like ransomware. You've all seen, I'm sure, the doom and gloom slides of people going out of business and the constant release of records and information. So we'll talk a little bit about how to protect against that. We'll talk about things in the development space. So for those of you who are actually creating software, creating products, whether that's in the cloud, whether it's on-prem, whether it's a hybrid solution, whether you're doing development just as component add-ons to other larger health care systems or record systems, talk about what secure development is, how to stay away from these types of attacks that are very, very common in the outside that we see because of kind of our expertise in being able to mature and expose and expand the SDLC, being able to create secure coding concepts in an environment, and be able to kind of stop some of these things that are traditionally happening anytime anything gets exposed to the internet. Then we'll talk a little bit about, you know, kind of the Internet of Things, how that works, how that's starting to play into the hyper-connected patient care. And then finally, talk about some of those things that can be institutionalized into the organization in order to kind of collectively start to build a security program that's not just driven by compliance, but it's actually truly driven around creating not only the best, the most reliable, the best selling, and the premium products that exist, but also being able to make sure that everyone that's using any product that we create or product that we consume has security built in mind. So at the end of the day, from consumer all the way up to provider, from business all the way down to consumee, we're able to be secure, and it's not something that's going to affect our business in the long run. Finally, a little bit about us, just so that you have some information on who we are. Loras has been around for about 12 years in the information security space. We explicitly provide kind of adversarial services, testing services, analysis and coaching services, specifically related to security. So we're not a firm that goes out and sells the boxes that fix everything. We go in, we take a look at everything that people have, we get an understanding of what threats may present themselves, whether that's doing, you know, mobile analysis for those of you who create mobile platforms, whether it's doing code review, you know, static and dynamic analysis of code, whether it's the sites that you're using in order to curate the data, whether it's the various levels of the network, both the cloud analysis, the on-prem analysis, the hybrid of that, of being able to say, what would an attacker do and how would they compromise the company, and then what would happen that could impact the business. So trying to remove people from the idea of just chasing vulnerabilities or chasing compliance, because as we've seen throughout the many years of business, compliance-focused approaches normally mean that within the first hour of a penetration test, the company will be fully compromised if they haven't done fair amounts of testing or tests throughout the life cycle of their build process. So we're seeing that usually about 30 minutes to an hour for a company that has passed compliance mechanisms, both HIPAA, high trust, you know, and all of those things. From a compliance perspective, once we get down to actual tactical security and how it works in the environment, you know, 30 minutes to an hour later, it's full control of everything in the domain of the company. We also provide some kind of virtual CISO services and other coaching services to help people get an understanding of how do we make the rubber hit the road, being that the security space is extremely wide. How do we distill this down to things that will either help the business, help the customers, better provide service, or better provide a care and safety. So really that's the biggest concerns that we have is bringing a sense of reality and a sense of security both to the compliance space and the healthcare space to try and get it out of the critical condition that it's been assessed being in. Finally, there's some other, you know, accolades of things that we've done in the team. You know, between the team, everyone on the team has a issue of about 8 to 10 years worth of experience explicitly in the testing space. So we've done these types of things for quite a while. We're contributors all over the world. You might have heard of things like the Verizon DBIR, which we're one of the data contributors to. I'm a fellow at IONS. I've created and made a fellowship at MITRE, creating attack stuff there, working DoD, DOI, NSA. We've spoken at conferences all over the world. We've written a number of books about these things. Effectively, this is what we live, eat, breathe every single day. So if anyone has any questions or needs or things that could help out inside of this blog series or ways that we can answer questions, myself, my team, and our relationship with Drummond, hopefully we can provide those answers or at least provide guidance wherever we can. Finally, here's a couple links to some of the things I talked about, like the Verizon DBIR or the Healthcare Cybersecurity Task Force that we helped out a little bit with, as well as a link to the first of the series of blog posts on protecting digital theft of EHR. Again, if there's any other topics that you'd like us to write about in the future or try and tackle, please feel free to get a hold of your Drummond representatives or us directly, and we'll help out and try and explain anything that we can to make sure that we're helping move the bar.
Thank you, Chris. And just before I let everyone go, because I know we are actually a little over time, just wanted to point out that we are offering 30-minute consultations. So if you have questions about anything pertaining to what you heard today with the ONC updates, the 21st Century Cures proposals, if you want to talk to somebody at Loras about some of the security things, either how to get started or just general questions on information security. If you have questions, if you have the EPCS certification and need the NCPDP updated script and you need to recertify and you just have questions on that or how to begin that process, or if you have questions on any of the other compliance services that we offer that we showed earlier. Again, we will be sending out the slides and a link to the recording to everyone that attended today. Feel free to reach out with any questions. We're happy to help. And thank you everyone for joining, and we hope you have a wonderful rest of your day. Thanks everyone.